Hello, my name is Jan O'Neill and I'm a community coach with the County Health Rankings and Roadmaps program. So before we get started, we would like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between RWJF and the University of Wisconsin Population Health Institute, which is in Madison, Wisconsin, which is where Justin and I are broadcasting from today. We do want to take a moment before we get started just to orient you to the technology we're using. The GoToWebinar attendee interface has two parts, and on the left you can see the viewer window where you'll see our screen throughout the whole presentation. On the right you'll see the control panel. So you can interact with us through the control panel by using the question section. Just feel free to ask questions or share your thoughts or comments through that control panel throughout the webinar. Don't be shy at any time if you have a question or a comment, and we will have time in the webinar for your questions. Just above the question box, you'll notice a handout section, and Justin has placed a number of handouts there to provide you with some background on the webinar content, including the slides that we're using today. So now to our purpose. On today's webinar, we're going to explore how to use storytelling and data to empower community members, shape community vision, and make your work come alive to the people that you want to influence in your community. So the question that's guiding our webinar today is, how can we use the combination of story and data as a tool for powerful change in our communities? I'm going to start with a brief program overview to ground our discussion in County Health Rankings and Roadmaps, and this will take a few minutes. If you're newer to us, it'll give you a high-level overview of our program. To learn more, we encourage you to check out one of our Rankings and Roadmaps 101 webinars, and Justin has chatted out a link to that to our most recent recording. So after that, we'll take a look at some tools and resources from our website that can help you engage your community in telling their powerful stories. This is going to be followed by an interview with Heidi and Delia to hear how they're doing that in New Haven, Connecticut. We'll then open up for your questions for Heidi and Delia, and we'll wrap up with some reflections and next steps, including telling you about an opportunity that will be coming up next week, an opportunity for a deeper dive with a select small number of people, up to 25, and it's going to be about using storytelling and data as tools for change, but it's really going to be an opportunity for dialogue with each other about that. That's not the same as our Q&A time with our two guests. So at the top of the hour, when the public webinar is done, if you'd like to hang around, stay on, and talk with our guests a little bit more with some Q&A, please feel free to do that. They're going to stay on for an additional 15 minutes. So here we go. This is our picture showing the thinking behind the rankings. It's our theory of change about how rankings can be a catalyst for action that improves the health of everyone in a community. We start with population-based data from a variety of sources. So we don't make up the data. It comes from all over. And then each year, the rankings report is released, and this year it's going to be released March 29th. And that generates a lot of national, regional, and local media attention. And that media attention gives you, people in your communities, an opportunity to tell the story of all the many different things that affect health in your community. And you can use the findings as an opportunity to then mobilize multiple sectors to look further at your own community's strengths and needs. Based on this deeper look at your unique priorities, then community members can identify evidence-informed strategies that can be implemented locally to make change. Over time, these evidence-informed strategies ultimately result in longer, higher quality lives for all the children and adults in the community. But essentially, the county health rankings aren't about numbers. They're really about a call to action. And the rankings are a starting point for discussion in communities, not the ending point. You're going to want to dig into your local data further to understand what's going on in order to know where and how to take action. And actually, that's going to be a lot of our focus today on today's webinar, how to dig deeper into those stories, into that local data. Our work at County Health Rankings and Roadmaps is rooted in the theory that health is the sum of many parts. I said that in the previous slide, that many things go into how long and how well we live. And this image, you may have seen this, for others it may be new. It's really the foundation for County Health Rankings. It demonstrates our broad definition of health. Starting at the bottom with the orange box and moving up, you can see the relationship between policy, health factors, and health outcomes. And as you can see, multiple factors impact how well and how long we live. So things like diet and exercise, education, employment and income, housing, water quality, and transportation. These are just some of the modifiable factors that influence our health outcomes. Here's an equally important image. This is an image of our Take Action cycle, which is in our Action Center in the roadmap side of our site. And looking at the center of the image, it shows that in order to address health effectively, we really need to harness the collective power of people from all across the community. No one organization or sector or group of individuals can do it alone. This multi-sector approach to community health improvement with community members who are residents at the center is how we can address the many factors that influence health. You'll also notice action steps around the cycle, from assessing needs and resources all the way around the cycle to evaluation, and then work together and communicate encompass the entire cycle because those action steps occur at the same time that you're completing the others. So when you visit the Action Cycle online, you can gain access to hundreds of practical tools and resources that can support you in your work moving forward in health improvement in your community. On today's webinar, our essential question is, how can we use the combination of story and data as a tool for powerful change in our community? So let's just take a brief look at some of the tools and resources we have available on our website to do this. The Community Assessment Tool from Rotary International is a great guide for engaging community members in meaningful conversations. It provides detailed descriptions, planning tips, and examples of how to conduct things like community meetings, surveys, interviews, focus groups, how to do asset inventories, and how to do community mapping. And Justin is chatting the link to you right now, so you can take a look at that. By the way, all these chat links are in one of the handouts that you can download, so you can look at these afterwards. Now, another source for storytelling can be found in our Communicate guide in the Action Center. Photovoice, it's a process in which people use video and or photo images to capture the realities of their lives in their neighborhoods and to spur change with the public and with policymakers. And this particular Photovoice image was presented by young people at a student leaders conference in Spartanburg, South Carolina. They're talking about housing units in their city and how they have no air conditioning and heat, and it's only on the ground floor that they have heat. And the guy who owns it is the Florida Dolphins football team owner, and he's not making them better. So this is a pretty powerful advocacy tool. And when the people themselves in the community can use it, and particularly youth, it can be really a great way to empower residents to take action. Now, for the quantitative side of things, you can check out our Using the Rankings Data tab in the orange navigation bar on our site. And Justin's chatting out a link to this right now. There's actually 7 sections in this tool, Using the Rankings Data tool. We're just going to highlight one today, the section called Finding More Data. That section links you to national and state data sources. So you can click on your state. What I did here was I clicked on Wisconsin. You can see what data may be available for your state at sub-county and or demographic level. And you can also check out national data sources like the Community Health Status Indicators, CHSI 2015, and that shows health profiles for all 3,143 counties or county equivalents. Another thing you'll find as part of this tool is Community Commons, which is an interactive mapping site that has GIS data for many different layers, even down to the census tract and tract layer. So pretty powerful tools. All of them can be found on our site. So now let's turn to our wonderful guests I would like to introduce them by first saying I have the pleasure of coaching the New Haven, Connecticut team right now, and these two women are key to the team's success. They are both brilliant, but also, as you can see and probably guess from the picture, they're really good friends and they're a lot of fun to work with. Heidi Gil has over 26 years of experience in driving systemic change and innovations across the healthcare continuum. She led the development and implementation of Plain Tree Continuing Care, adapting that internationally renowned patient-centered acute care model to the needs of post-acute environments. And then after that, Heidi worked to expand it and provide coaching and consultation to CEOs and affiliates nationally and internationally. So today, Heidi's the founder and president of HPG, which is an organization dedicated to inspiring individuals, organizations, and communities to thrive through seeding extraordinary breakthroughs. Delia Mannen is HPG's research fellow and project coach. Delia has been conducting research since 2010, including field research, active research, case studies, ethnographies, archival research, and mixed method studies. Her main focus involves how human beings grow, prosper, thrive, and live to the fullest. She draws from disciplines of ecological health and wellness, human health and wellness, organizational development and change, design, and social justice. So, welcome Heidi and Delia. Hello.
Hi.
Hi.
Thanks, Jan.
Great.
Hi, Jan. Thank you so much.
Yeah, great. So how about we start with you telling us, Delia, a little bit about New Haven and kind of give us the table setting, the context for your work there, if you would, please.
Sure, happy to. As you can see on this slide, New Haven is a New England coastal town. Greater New Haven is made up of 13 towns, and there's a population of approximately 465,000 people. Yet, interestingly, 54% of Greater New Haven's poor live in only 6 neighborhoods within the city of New Haven. There are 363 nonprofit organizations, 50 in health alone, and 59 documented collaborative initiatives. There are also 6 institutions of higher education. As is typical, and probably many of you are familiar with this, funding is being cut across the board, and there's fear about that. Services remain siloed. An interesting fact is that the people who make up Greater New Haven, more than any other region, closely represent the demographics of the United States. So for us, this project has really been an opportunity to test and pilot programs and services in a really manageable way that may be scalable. Another interesting fact that I learned by working on this project is that zip code is a better predictor to health than genetics, which really reveals the importance of looking at social determinants of change as upstream prevention.
That's great. Thank you, Delia, for sort of, laying all of this out for us. And I'll bet people will find some commonalities in their own communities. Could we zero in on your project and why this is happening? Could you talk a little bit about that?
Sure, I'll do that, Jan. This is Heidi, and first I want to thank County Health Rankings and Romats and Robert Wood Johnson and all of you for your interest today. Great to be here. So I'll set the context of the project by covering the why, and we often address the compelling reasons with 3 questions. Why the Department of Social Service, why Leeway, and why a community living model? So first you see here, why the Department of Social Services? Well, DSS started a nursing home diversification program, which was aligned with these 5 state key priorities that you see listed here on the slide. This program gave nursing homes a very specific opportunity to diversify their services and align with the money follows the person efforts, which ultimately enhances informed choice for individuals to remain in their homes and not in the nursing home environment. So with person-centered choice at the core, this funding is truly aimed at increasing the access and awareness to long-term care service and support so that individuals can remain at home, as well as piloting care management interventions that will decrease the use of nursing homes, ER, hospital, and ultimately mitigate the gaps in community-based services and supports. So moving on to why Leeway. Well, Catherine Kennedy and Leeway's founders were pioneers in New Haven when they opened a skilled nursing home back in 1992. At that time, they were solving for a significant crisis and a gap in specialized care and services for those living with HIV/AIDS. Leeway quickly became a place of refuge where hope happens, and as many describe, a place where people go to find dignity. Building from the strength and expertise of providing dignified, complex care, Leeway will expand its mission beyond any one disease to support all individuals who wish to remain in their home environment.
And Heidi, you call your approach to all of this the community living model. Could you tell us a little bit about what that looks like?
Absolutely. Well, first, the vision, philosophy, and approach of co-creating a community living model arise from a partnership between our organization, HBG, and CAMA Incorporated. These concepts are all aligned, Jan, with the overview you provided this afternoon, and I'm sure these concepts are already very central to the work that many you do today on this call. So what does it look like, and how can we co-create a new model that is tailored to each community? Well, the first phase we call is program collaboration and the development of places of dynamic services, or pods. In this phase, we're working to embed a care coordination team while transforming the overall system of care coordination. We aim to first leverage and connect the care coordination and strong programs that are already in place in New Haven's ecosystem, and there is so much great work happening in New Haven already. And second, then, broaden and build upon what is needed most for seamless access to care and services. So you see the type of pods are the circles, and as depicted in this graphic, we aim to solve for the time between medical interventions through this lens and focus on the social determinants for change. So for those striving to remain in the home environment, how can the care coordination system ensure that spirituality and purpose, social connectivity, and nutritional supports, and access to transportation at the end of the day are as integral as the next doctor's appointment and the next prescription? So ultimately, these pods will work to perfect warm handoffs between medical and social care in a manner that honors choice and truly improves lives. The second phase we move to is called service integration in the development of the community living model. At this time, we design a place of well-being, or what we refer to as the POW, a place where both medical and social care is provided with seamless access to services under one roof. A place supporting needs beyond any one diagnosis, and an environment where just being there would truly feel healing, and that social supports and learning opportunities are abundant. It is a one-stop shopping concept, mitigating the need to navigate throughout a large city and decreasing the amount of transportation required. Community agencies and key staff from the pods would be located in the same place as they strive to enhance communication, collaboration, and integration of services on a daily basis. So together, the POW and the pods are a hub-and-spoke approach that is a tailored approach to meeting the needs of a community, with answering an important question: how can the pods and the POW collectively change the stories and the experience of care from surviving to truly thriving?
So I thank you very much for explaining the what of what you're doing, the project, and we'll spend just a couple more minutes on the what and then get into the how of the using story and data and so forth. But first, around the what, in the who, is there a target population, and what's expected from the project at the end of the day?
Sure. I'll tell you a little bit about that. This is Delia. So we began with the really broad goal that was defined by the Department of Social Services for the state of Connecticut as it is a grant funded by them. And the one metric that we are ultimately held accountable to is to reduce admissions to skilled nursing facilities by 1.5%, and thereby increasing admissions to a home at the point of discharge by 1.5%. So we had to figure out who our target population was going to be by which we would achieve this metric, and we narrowed that population to those with multiple chronic illnesses. And then we discovered through many conversations with different healthcare providing institutions around the city that often those with multiple chronic illnesses often have mental health issues and substance abuse issues. They deal with poverty and they deal with homelessness as well. So we conducted numerous meetings with the major healthcare system to further hone in on the population that we would ultimately pilot the model of wraparound care with, and we hot-spotted to identify those with the highest cost and the highest risk, which make up a small population to pilot. That's a little bit about the target population. In respect to desired outcomes, there is the outcome of the goal that we're aiming for provided by the state, but we were also motivated by a few inspirational questions. How can we work to improve the health and well-being of the city, and how can we do this in a way that is dignified and person-centered and with individual choice at the center? We have underscored the project with the following philosophies in the hopes of achieving our desired outcomes. Our approach is grassroots, it's bottom-up, and it is not top-down. It's multi-stakeholder in that all are invited to every table to make decisions. It's collaborative in that we aim to be non-duplicative and we aim to build on and with. And there's a great metaphor that the city uses where they speak of each organization finding their own lane so that the flow of traffic is aligned better and all are moving in the same direction. While these are all high level, we are hosting visioning sessions to move these desired outcomes to action.
I love that metaphor. That's great. Direction, alignment. So let's move into the Living Storybook. This was so intriguing as I was coaching your team. That was the very first thing you all shared with me. It really is a unique approach to visioning, asset mapping, and needs assessment and storytelling. And I'd love it if you could tell us more about what it is and its power in transforming community improvement work.
Thanks, Jen. Happy to. So the Living Storybook ultimately is about forming one relationship at a time and telling one story at a time. And oftentimes when we're working in a complex scenario, and what we've learned very much through this project is building trust is through building strong relationships. And how do we document how those relationships are coming about? Well, this Living Storybook is the unfolding story of a community working together to co-create the community living model. Each phase of the project has its own chapter, and all stakeholders are the author. As we progress through the project, subsequent chapters are written, and as great change occurs, the progress is well documented. The Living Storybook includes many quotes and stories of individuals we are serving, keeping this project grounded in the voices and stories of the targeted population. So Chapter 1 evolved from a community think tank and is an introduction to the project addressing the why. The next chapter, which was just released, we're so excited, covers the needs and strengths in New Haven. This is a qualitative and quantitative data analysis which was gathered and utilized to ensure that the project underscores what matters most to community members and the leaders in New Haven. It works to align the data to what is important to happen, as well as the initiatives already in play. So this chapter covers this philosophy and the work that we're doing, the approach that we're taking to change, the guiding principles that were developed through a qualitative analysis of all the voices across New Haven, and then the data in alignment with city initiatives, making certain that we use the rich information that already exists in New Haven and that we brought in a build upon what's working. And then finally, how do you take all that data and execute? So this chapter is the story about how we're moving that data to action. Both of these documents, I believe, we may be chatting as we speak.
Yeah, I think they're actually in the handouts, right, Justin? Right. So when people go to that control panel, they can download this. That's great. We're also seeing,
Fantastic.
yeah, and people were having a little bit of trouble with the community living model white paper, and Justin found the link, a link that worked. So maybe you could, I don't know if you chatted that out to everyone. That's perfect. Yeah. So let's do a little deeper dive into your approach in philosophy to change, and how this story is a part of that method and philosophy. That's you touched on that, and I think Delia, you're going to be talking about that.
Yep. hmm So building on our philosophy of a grassroots multi-stakeholder inclusion approach to systematic change, we've also emphasized a strengths-based philosophy, knowing that we will achieve much more by building upon what works than we will by trying to shrink our gaps. So frequently we come at these projects looking at needs to fill, and with this we took a little bit of a shift. So we started with the stories and the voices of the community through the collection of qualitative data. And I got to say, it's really been a labor of love and a privilege to speak to so many community members, to hear their stories, their points of view, their ideas and dreams of the solution. 286 voices have been heard, and they represent 69 organizations. We used an appreciative inquiry methodology that explored and discovered strengths, successes, and potential of the very best of New Haven. Lots of dreams were involved. Questions revolved around flourishing, well-being, community, and collaboration. We audio recorded the interviews after ensuring anonymity so that nobody's story could be identified. We had them transcribed, and then we reviewed the transcripts and pulled out really, really powerful quotes, the kind where you read them and you're just like, oh, that's so beautiful, and your hand goes to your heart. We have a list of close to 400 extremely powerful quotes. Myself and a grad student coded them independently and then cross-coded the quotes for common themes. Themes were then clustered and became the powers. And this is where we began our data collection. We'll tell you more about how we used quantitative data to contribute to the findings of the qualitative data in just a few slides. In a second, we'll show you a visual that represents the 8 powers. They are all very rich in and of themselves, and I encourage you to read more about them in the Living Storybook. They really do reveal what the community of New Haven believes is core and essential to the process of designing a model of wraparound care that supports individuals to thrive in the community. But first, I'd like to give you an example of how one power emerged, the power of dignity. And you see this quote on your screen, and I'm also going to read it aloud. It was spoken of by a caregiver in the community, and this person said, "I always say, when I look at you, I see me. When I look at someone in a bed, I see me. We forget how fragile we are. We all are not perfect. We all are made from the same type of mold." This quote speaks to the fact that fundamentally, despite all of our differences, we are all human. When stakeholders spoke of being treated like a human, they spoke of the common themes of being recognized, respected, treated as an equal, and met for where they are at in their individual life. From this quote, along with many others with similar themes, they were clustered into the power of dignity. And it really has become core to this project. In all the decisions we make about a model of wraparound care, we ask ourselves, how is dignity a part of this decision? How can it be more a part of this decision? How do we ensure that dignity remains a part of the action? And so is true for all of the powers. In the
So,
next slide, yeah, oh, um, Jan, do we have a slide with all the 8 powers in the circles?
Yeah, we're showing that right
Oh, I'm
now.
sorry, I missed
Yeah,
it there.
no,
Sorry.
that's all
One
right.
more comment about
Yeah.
that.
Did you
We,
want me to stay on this slide, or are we ready?
yeah, no, that's perfect.
Okay,
I missed that there. So
no worries.
we know that systematic change is complicated and messy and sticky at times. And part of the reason is that we have multiple levels of analysis to which we are working to affect change at the same time. There's the individual, the organization, and the community. The powers really speak to and underscore each of these levels. So if you begin with dignity at 12 o'clock and move clockwise around the circle, you'll see this progression of guiding principles that are first fundamental ideas and philosophies, to the individual with the power of self, to a dyad with give and receive, a group with the power of care, to a group of groups with collaboration, a community, and then the city itself.
I just love this image, Delia and Heidi. This is wonderful. I love how you grouped things into these powers, like empowering the community. So I want to shift a little bit now and ask you, how did the quantitative data and your assessment of needs build on these beautiful stories that were collected from all the voices of stakeholders, and how did it build on the guiding principles, these powers that came from these stories? If you could talk about that a little bit.
Sure. So we began to align our work by first understanding how we can solve for downstream outcomes. And downstream outcomes for this project are chronic conditions that result in hospitalization and or nursing home placement. And then we looked at how we can support the implementation of upstream goals. And again, for this project, upstream goals are prevention strategies for chronic diseases that will enable individuals to thrive in community. The next slide, I'm just going to give you a really high-level overview of this visual. That we call it a placemat, but we don't intend you to read all of the text right now. It's in the Living Storybook Chapter 2 if you'd like to read it later. But I'll explain kind of how the visual does work. So we found that New Haven has multiple organizations that have conducted extensive research on health and wellness. And so we were really lucky to have existing impressive reports and planning documents. There was no need for us to conduct a traditional needs assessment or surveys. We scoured these reports, we held many meetings with decision makers, and then we identified our sweet spot that adds onto and does not duplicate ongoing efforts. For us, there are key focal areas of the city that helped us identify where to land. And so you see those 5 columns, and within each column you see quantitative facts that are true of the population in New Haven. Those are upstream, and ongoing initiatives. Those are downstream. What this graphic does is it puts this information down on one piece of paper so that the data can be easily moved to action. And I believe Justin is going to share a few links if you have any interest in reading the documents from which we pulled the quantitative information. And then we have just a very simple visualization of what was just covered. And the facts have been removed. As the conversation in healthcare shifts to value-based care, the scale is really tipping so that a focus on well-being and preventative measures is increasing. And that is where a focus on social determinants of change that affect upstream goals and targets is crucial. Within the context of a model of wraparound care, this means a house visit to ensure that a refrigerator is running and clean and stocked with food, as well as a walkway is shoveled. As our models shift, so do the questions we ask and the answers that we get.
You know, I just love the visuals that you were able to, I think, use that framework to pull together the quantitative with the stories, with the principles. I think that's so powerful, and I really appreciate you taking us through the process for getting there. There's so much more in the Living Storybook, and people can explore on their own. But if we could just shift here as we sort of move toward our Q&A, what are your next steps for this project?
So what you see here right now on the slide is our deployment structure, and I believe this deployment structure can be used uniquely in any community that's interested in moving information to action. You see at the center of this deployment structure is our Wisdom Council. The council consists of residents in New Haven and our targeted population. The role of this council is to ensure that the consumer and patient family voice is heard and central. They assist us with identifying needs, priorities, they broaden awareness, as well as actively participate in decision making. We've had multiple meetings with our Wisdom Council, and their passion for this project, it just continues to fuel us and gives us goosebumps all the time. This council, along with the voices of so many individuals, is truly the big power of this work. So when you look around the circle beyond the Wisdom Council in the middle, you will see 5 key visioning sessions with multi-stakeholder groups that will be coming together. First, we'll start with care management. Care management will solve for how to integrate current management programs together, ensure we're not duplicating, and ensure that we're filling gaps and integrating, again, as we've said many times, what is already working. The pods will identify ways to deepen collaboration through shared guiding principles and the powers, looking at technology, looking at data analytics, looking at shared training and shared marketing opportunities to build and increase awareness and access to long-term care services and supports. In terms of awareness, we want to move a grassroots campaign to transform how people find out about what's available and build stronger access one neighborhood at a time. For the training group, we'll focus on the need of the targeted population on 3 levels, on an individual and organizational, across the pods, if you will, and at the community level. And then finally with the POW, with our partner in CAMA Inc., we will design a place of well-being that will create a new place in New Haven that embodies all the powers that you heard about today. When you move to the outer circle, you'll see the Leeway executive team, the board of directors, and the advisory council. They will all guide and execute the vision and monitor and evaluate the overall progress of our work. So all of these groups collectively over the next several months will be in many different visioning sessions, moving this data to action, and ultimately are going to be the authors of Chapter 3 of the Living Storybook. So again, this is not something you can sort of read on this slide, but it is in the Living Storybook, and we do refer to it as a placemat. And it is a placemat that really is a summary of this story of unfolding change to date. And it helps stakeholders to understand how we're moving qualitative and quantitative data to action. In the core, right in the center, you see those powers. And on the outside, the alignment to the downstream outcomes and the upstream goals and targets. And around the center of the powers are the 5 action groups I just reviewed. The pods and the POW will work to build a beautiful backbone infrastructure for the City of New Haven. The case management training and awareness groups will focus on improving program collaboration, integrate services, and ultimately mobilize that community to create a new system of care and well-being. So this model at the end of the day is created with and for residents of New Haven, and we're real excited about how the story continues to unfold in the partnerships and relationships that we are finding there. But in closing, it's important for me to also say that we recognize the leadership of Leeway. Heather Aaron and Kimberly Turner-Hugabuk are amazing, and its board of directors. And also DSS, so supportive, Don Lambert and Maureen Painter. They're all very committed, and it's with an authentic commitment to this co-creation that we believe all boats have the potential to rise. And as the Leeway board chair says, Mr. Dyson, who is just this amazing pioneer in the city of New Haven across the state, what he has said is that we will aim high and we will shoot for those stars, but if we fall through the clouds, we will still be on higher ground.
That is terrific. That's a great place to pause here, to take a breath. Thank you so much, Heidi and Delia. And we have lots of questions from folks. So how do you how did state employees find the resources, the time, and the staff to collect qualitative data? Could you hear that?
Yes, we
Okay.
could. So, yeah, so you know, I have to say, in this grant, because we knew we wanted to take a grassroots approach, and how important it was for us to build on the story and the voices that are there, and for that to propel the work, that a qualitative approach was going to be so important. So we were able to write into the grant this work to do it right, which we're so excited about. I have to say that this entire project represents a decentralized approach that the Department of Social Services has taken to make certain that this issue of long-term care service and supports are really solved for one community at a time. It's about 169 communities across our state, and each one is very, very different. I believe that we're just very fortunate that they could see the value in what qualitative research could do to mobilize in community.
Well, and actually there's another question that's related to that, but it has more to do with the community members themselves. How did you elicit introverted storytellers to discover their inner confidence to share their stories?
I can take that one. As a qualitative researcher who's been doing this for a few years, what I find is that if you give people some time and you invite them to tell you their story, people are often very happy to do so. They're very happy to be heard in a way that acknowledges that they're important and that you want to hear what they have to say, and that they're able to contribute their story to affect change. And so it's honestly never really been an issue. It's never been a challenge that has had to be overcome, but something else that really does contribute to that is in the interviewing process itself. I think often when we are telling somebody something, there's a lot that's in our mind that we don't speak in words, that we think the listener understands, but doesn't. It doesn't get translated. So you can ask questions to probe further. I always like to say, you know, if you had a camera on your head and you walked into a room, what would I see? Who would be there? Would I hear anything? What actually happens? Like, walk me through step by step. And then once you kind of get to that level of detail, you can probe a little bit further based upon what they say. If they tell you about a friend, oh, how long has that person been your friend, and where did you meet them, and which brings them back to a different point in their past. And so part of it is the fact that people like to tell their stories, and part of it is the skills of an interviewer to probe deeper with these friendly, non-imposing kind of ways.
Yeah, which I'm sure you're very good at, and then you train others in how to do that? Is that part of what you do as a researcher?
It is, and for this project it was a part of it as well. In the beginning there were a few of us who conducted interviews, and so collectively we kind of reviewed the questions that we were going to ask. We designed them to be semi-structured, which means you kind of have permission to veer off of the interview's script and go where the conversation goes. But yeah, that was a part of it. Things to think of when you're an interviewer, and how to keep the interviewee comfortable in the situation. Especially when, I mean, we're asking people to be vulnerable and to trust us within 5 minutes and for the next hour. It's something you have to establish pretty quickly.
Yeah, and actually a kind of a follow-up to that is one of the questions is how do you incorporate cultural sensitivity? So for example, you know, if somebody is Native American or Hispanic and the researcher or interviewer is not, you know, how do you incorporate that into the Living Storybook?
So in the storybook itself, I really would like to give a nod to Heather Aaron, the executive director of Leeway, and this is forefront on her mind. And every time we've ever sent a draft to her, she's made it a point to nudge us to be as all-inclusive and representative as possible, and that's really a reflection of the city. It's a big there's a lot of diversity here, and so we aim in the images that we show to show a lot of different genders and races. As far as interviewing goes and cultural sensitivity, as far in the interviews themselves, if somebody is a Spanish speaker, we try, but you're limited by the resources that you have, and nobody on the team was bilingual, but there were times where there'd be people when we do a focus group, and there would be kind of an in-betweener who would be able to translate the question for somebody else, who would then answer in their native language, and then the in-betweener would report back to us so that that person was not left out.
And by the way, for people that are on the webinar, if you have ideas for that, if you have ways that you've done that, please chime in here and we'll share that out with the group. Matt is wondering if we could circle back to who the target audience was for the Living Storybook. Is it used as a follow-up report to the granting organization or to get more participation in the program? You know, who is it really, who's the audience for that, the Living Storybook?
So Delia, I can take that if you want.
Great, go for it, Heidi.
So, you know, we started, as Delia mentioned, I think, with a really broad question of how do you discharge individuals and increase the amount of discharges that go to home versus a skilled nursing facility. Ultimately, going back to the why from a Department of Social Service perspective, the key is to make certain that if they can get people home until instead of the skilled nursing facility to begin with, that's the first place to start. So when we look at then, you know, what are the obstacles to going to home, and you know, who is actually going to skilled nursing facilities, you know, what we wanted to do is really uncover, understand that, but also the other piece to this is really thinking about how if people are going to be living at home that once were and then the nursing home environment and an institutional level of care, we also have to solve for if you have a high acuity individual person in the home environment, what are we going to do to prevent that readmission to the hospital and ER? So when we thought about the target population, what we really were looking at and are looking at is first sort of the high cost, high need individuals that have multiple chronic diseases and have the opportunity to live home, but only if the services and supports are more robust. We also found in New Haven a real need to focus on the support for those with mental illness and substance abuse. So when we target our population, we'll be looking at about a top 100 individuals that are the high cost, high utilizers, and really test whether or not through better home-based wraparound care that we can have those individuals successfully thrive in the home environment. We also, in the hospital, are using, with Yale New Haven Hospital, a tool called the Right Care Tool, which helps care managers determine whether or not someone is more appropriate to go home or to a skilled nursing facility. So that is another population that we'll look at, those that are being discharged out of the hospital, and we'll be looking to see how do we help care coordinators think about different ways, and families and patients themselves, ways in which home may be an option. And this Right Care tool is a way that we'll be able to triage individuals that really have a score that may be on the high side, meaning that they have a high risk if they go to the home, but really question that further and say, is there a way to honor choice and get that individual home someone that probably would have gone to the skilled nursing environment? So I hope that helps. Delia, do you want to add anything to that I've missed?
Yeah, I do. In Matt, I hope that Heidi just answered your part of the question where she's talking about the target population that we're serving, but as far as the target population of the Living Storybook itself, so we use this as a tool in a number of ways. I think you asked specifically about reporting to the state, and we have a more formal, much less graphically designed Word document that ends up being our quarterly reports to the state. This document is used more to share information, get buy-in, and to inspire. And as we've mentioned throughout the webinar, you know, it's being written as the change is happening. So it also kind of confirms participation as people see their contributions as each chapter is written. In the slide that showed the different pods, the people who actually pick up the document and read it include the grantees, the grant funders from the state, you know, that they definitely do, as well as Leeway executive board and an executive director, and then the pods themselves, so all of the healthcare providers in the city, and then different well-being buckets such as integrative therapies, the mental health organizations, the substance abuse organizations, some of the housing organizations, and we get it into the hands of any and everyone, and definitely the community members as well. And I think a little bit of a underlying question in your question is that the population is a broad mix of individuals with varying levels of education, and so we work really hard to have some thickness and that's comprehensive in the information that we share, as well as some simplicity in the graphics and the words that we share. So no matter who you are, as you're flipping page by page, there's something you're picking up from a page.
Thank you very much. Yeah, Matt's saying yes, that's what he was interested in as well. So thank you. Thanks, both of you. Oh, I love this. And Jackie is saying, going back to the question about addressing, you know, language needs, that if you want, she, I think, has used a call-in translator if you know that there'll be language barriers in a focus group. So that's another way. I love that people are sharing with each other here.
Awesome.
Yeah.
Yeah. I love that people are sharing too. And just a quick note on that, you know, we would love to connect with anybody offline and be able to crisscross sort of what you've done and what we've done so we can continue the learning after the webinar.
That's really great. That's timely because actually there is going to be an opportunity to do that. That's a little more formal in a week, and I'll talk about that in just a moment, but we could also, people connect with you through email. We're coming up to the top of the hour, and we will have an additional 15 minutes with Delia and Heidi, and we've got some more questions for you all. So I think what I'll do right now, if you all don't mind, is just wrap up, and then we'll stop the public webinar, if you will, but we'll keep going with the additional 15 minutes of Q&A. And apologies for Justin not being able to get on his headset here. So great. So just going back to our guiding question, hopefully you all on this webinar do have some answers to this and maybe even some new questions that can take you further down the road of using story and data as a tool for change. We always ask you to think about these reflection questions after each webinar. Who else do you need to share this with? What's one idea for action? And then what else do you need to know to take action and use this information? And there will be, again, I'm going to highlight the opportunity for doing a deeper dive in just a moment. And when we talked about moving from data to action at the beginning of this webinar, in addition to our website, countyhealthrankings.org, which is rich with data and tools, we also have 11 coaches across the country who can provide consultation and link you to resources and help build your capacity to improve the health of your community. And that is at no cost to you, thanks to the support from the Robert Wood Johnson Foundation. And you can connect with any one of us by clicking on the Get Help buttons located throughout our website. Anybody can contact us at any time. I would just like to mention to stay in touch with us through social media, and that's through Twitter and Facebook and our e-newsletter, and Justin is chatting out those links as well. So here's the new opportunity that I've been alluding to. We're calling it the post-webinar conversation. I'm not sure if we'll stick with that title because it's not a conversation right after this webinar. That's Q&A. It's a conversation in 1 week. And it's for this webinar, Power of Storytelling, it's going to happen February 14th, Valentine's Day, 2 o'clock Central, 3 o'clock Eastern Time. And the purpose is to give you all a chance to dialogue with your colleagues and with us about using data and storytelling to create change. And of course, Delia and Heidi, we'd love for you to join us if you'd like to. We're kind of thinking that it may be an opportunity for an ongoing learning network. We'll see how much interest there is in this. It's going to be a facilitated and we hope very lively interactive session, not a didactic webinar, kind of different than our standard webinars. We highly encourage the use of video, so if you have a video cam on your laptop, if you can, otherwise you can join us by phone. But it's really great to be able to meet other folks from around the country and talk face-to-face to build that network. We do have a limited capacity, so please do sign up early. We want to know what questions you'd like to dive into, and the earlier we know what you want to know, the better prepared we'll be to facilitate a meaningful conversation. Justin's going to chat the registration link. If you want some help with technology, let us know. We also are going to open up the room 15 minutes in advance. We're actually doing this through a different platform called Ring Central, and so we will be there to help you with those tech issues. We ask that you think about these questions in advance, and we're going to be discussing these and a few more. Joanne Lee, who's from Active Living by Design, one of our partner organizations, is going to be the lead facilitator. And if there's great interest in having more conversations on storytelling and data, there's going to be an opportunity to continue those conversations with Joanne Lee's support, thanks to the Robert Wood Johnson Foundation. So come and be part of this inaugural network. We'd love to have you join us. And if you are going to join us, think about what about this webinar, Storytelling and Data, stood out for you, just 1 or 2 words. What parts reminded you of your own work in your community, and where is more work needed in your community around storytelling and data? So that's what's coming up on February 14th. And I am just going to thank Heidi and Delia now, but please don't go away. We're going to have a 15 minutes of Q&A. And to our participants, thank you for taking time out of your schedule to join us today and to learn about storytelling and data. And for those of you that are able to, please join us on the registration link, and for the if you can join us for Q&A right now also, we'd love to have you. This officially concludes our public webinar, and have a great afternoon, everybody. So thank you. And now we are going to continue with Q&A, and we do have some more questions. Actually from Matt, just to continue. I love this, Matt, you're calling it the post-game show. What's been the response to the Living Story? Have you seen the results you wanted? I love that.
Well, I think it's, it's one of those things that it's too early to tell, but we have gotten a lot of very positive feedback in terms of it being inspirational and a real different approach. I think it's they're feeling that something feels really different here, and they can see it and feel it, I think, in all the steps that we're taking. And really it has everything to do with the fact that New Haven is already ripe and ready to just move mountains and really do some breakthrough work there. I think it's been a community that has done a lot of planning. They've done a great job collecting information and data reports, and like anything, the hardest part is the execution of all these great ideas. So I think that they appreciate that the Living Storybook helps to align what's working well, and honors that, but also is giving the inspiration and the feeling of possibility for execution. Delia, what is some
I'll
of your
add
thoughts?
Yeah, I'll just add one more thing to that. It's an anecdote. So on the cover of chapter 1 is a gentleman. His name is Freddie, and I don't think Freddie would mind me sharing his name. He lives right down the hall from where our office is, and he's become near and dear to us. You know, whenever we're in the office, he comes and knocks on the door and says hello and tells us about his day. And he's definitely a part of the population that we're serving. And so we had a photographer come in town one day to take pictures, to take some photographs of individuals you see sort of speckled throughout those chapters and other media pieces we've used. And as you know, having stakeholders of all stakeholder groups be present, we often invite you know, the population that we're serving to come sit at the table, and they sit side by side, leaders from City Hall and from Yale New Haven Hospital. And at our first really big think tank breakfast, Freddie was there, and there were about 50 or 60 individuals in the room, and we started with everybody just kind of going around the room and saying who they were and which organization they represented and what their title was, and you heard a lot of big titles. And then Freddie happened to be at one of the last tables to introduce themselves, and he stands up, and he had sort of, you know, one of those paperboy kind of hats on, and he takes off his hat and he picks up the Living Storybook and he says, "I'm Freddie and this is me on the cover." And he was so proud to have been a part of it. And so the reception definitely varies, but I do kind of agree with what Heidi said. Just only the first 2 chapters have been written, and what we're looking forward to is the opportunity to write more living storybooks with others in other projects down the road, and just watch it as an artifact kind of grow and be used in these different ways.
And I'll just add, I think that what we found with just working with some of the government officials and folks that have just really had some amazing background in change management, just the thought of documenting this change and its evolution and how it will continue to propel really propel the feeling of possibility, the feeling of work getting done, and using that data to drive change. I think it's important that we continue. I love that you brought up the cultural diversity aspect, and certainly health literacy issues as we continue to unfold this and we continue to move a grassroots approach. We have to consider how this book evolves, and we would love your feedback on how we might do that. But that's going to be incredibly important.
I love that story about Freddie too, and about how he sees himself in the story and the others. I actually had the pleasure of sitting in on your webinar that you did in the last couple of weeks, and who was the gal you had from the community who was
It was
talking?
Diane who
Diane.
shared
Oh
her
my God.
story. Yeah, Diane.
That was so great. And she really sees herself in it, and it's like, I'm part of this. That's so great. I'm going to ask you kind of a little wonky one here. How do you best link statistical data with personal stories? So how do you link the quantitative with the qualitative? We know that you showed us the framework with the upstream, downstream, the placemat and all of that, but is there some easy way to explain how you link them? What drives what?
Yeah, I guess I wouldn't word it that way. I don't think that they're causal or linked in that kind of sense where you have, a quote that contributes to a fact. I think they sort of have support different purposes, but together the broader purpose is much more informed when you have both. And we haven't talked about it today, but the other kind of point of data that we used an incredible amount in this project is some exemplar case studies. And so those three triangulated together really help the conversation and the direction and the action. What the qualitative does is it gives it a heartbeat. It makes it human, and it makes it not an Excel spreadsheet and some numbers that are deduced to math and probability, because we're talking about human beings, and human beings are complicated and complex, and you can't do that. I mean, we have all these different disciplines that study all these different aspects of what it means to be human, but you, none of them encompass it all. And so what the qual does is it really makes it personal and heartfelt, and it shares emotions. What the quant does is it speaks to the facts. It speaks to what we do know in a very quantifiable way. And there are some people, and that's the kind of information that they are looking for, and that they will, the only kind of information that they will accept to make any kind of decisions. And so you need it. You need both. And then the case studies are able to say, okay, with quant, you've got this likelihood that something could happen, but with the case studies, you can see that, place X, try this and it did or didn't work, and here's why or why not. And so the knowledge just builds upon that.
Yeah, that word triangulating is so important, and the Japanese use the term KKD, Kaiken, Kaiko, Doiko, and it's like you step back from the data, both the qualitative and the quantitative, and you say, what does your gut tell you? You got to bring that to the story as well. What is the story that we're seeing here? So yeah, thanks. That's great. Well, we have another one here about results. Veronica's asking, can you give an example of a health service that was enhanced because of the Living Storybook? And I know you're early in this process, so but if you've seen any indicators of, hey, the health service is improving, that people are getting better service.
So I think that it's, again, we are on our second chapter, and I cannot wait to the moment that we are able to say that. I love that question, and I'm going to keep it, like, I'm going to actually put it in bold next to my computer every day I wake up, because, that is key. At the end of the day, are we making a difference? Are we making an impact? And how does this living story make an impact? And I guess what I would say in terms of impacting services, I think we've got such well-meaning, wonderful staff in play, particularly care coordinators across New Haven, really working hard. They're unsung heroes. We call them, the Ninja Turtles of New Haven that we spoke with, that they have it down. They have these warm handoffs that are happening, and it is actually sort of the Living Storybook as it plays out, I hope, really just leverages the great work they're already doing. But unfortunately, the organizations are still pretty siloed. They're hitting their head against the wall often in terms of bumps in the road because of the way things are so siloed. And there's not enough of the care coordinators to go around at the end of the day, as well as it's sort of like the air traffic control that's needed to make certain that there's not too many hands in the pot. So what I'd say about the difference that I think the Living Story is making, it's validating people. It's saying, we hear you. This is what needs to get done. This is what, from the perspective of those who are living and trying to thrive in community, this is the perspective of those who are caring for individuals. How do we come together and have a bold vision and make breakthrough change? And I really do think it's It's honoring and validating people as a first step, and I think that is where you can get traction for change, is when people say, okay, aha, someone's listening, someone gets it, I'm going to be at the table, I can now be a decision maker, and we're going to do this.
And also, I just want to point out, let's talk about the Culture of Health Prize just for a moment, just to give you guys some kudos. Can you talk about that at all? Because I think that's part of the story of what you're doing this on top of everything, not on top of, you're building on strengths in your community that have been well recognized by RWJF. Can you talk about that just very briefly?
So I don't know that I am the best expert in speaking to that from the perspective of what has happened in New Haven at this point, but what I will say is that New Haven has a very robust community transformation plan that was put together with a multi-stakeholder group, and they also have, Yale New Haven Hospital has the Healthier Greater New Haven Partnership, which are really two plans and guiding forces to the initiatives that really, I think, has given the acknowledgement from RWJ that this is a city that is committed to making change and committed to moving things forward, and so that's real exciting that we're like in this time and place where a lot of the planning that has been done is being brought together, and people are just bursting at the seams to execute.
Well said. Thank you. I put you on the spot there. Sorry.
Yeah, that's
but,
okay.
but absolutely. I mean, that's a big part of the New Haven story is, and yeah, and you're working with Yale, you're working with everybody. So this is all coming together. Do we have time for one more? Okay. And Justin, I think well, there is sort of a beginning storyteller question. So going back to that, for people that are new to the field, how do you begin storytelling? And somebody needed some help conceptualizing. Where do you begin with that?
That's interesting, a very interesting question, and I can take a stab at it, and then Heidi, I'm sure you have some thoughts, and would love to hear your perspective too. I think you begin by asking what story is it you want to hear, or what's the story that you want to tell, and you have to figure that out first. Is it about a person? Is it about, a persona? Like, is it about the target population itself? Is it about community and community coming together? Is it about, a verb and action? Is it about collaboration, for example? Is it about the outcome you're ultimately going for? And so for me, it's really kind of stepping back and saying, if I were to pick this book up off the shelf, what do I want this book to be about? And then it's also understanding, I think we all know when we've read a good story. There's some classic elements to it that move you, and it's trying to weave those in to the story that you're telling. But I have to say, from this project and past experiences, people telling their own stories have all of that magic. There isn't too much effort that you have to put into it to get something great, except for time. You need time. It takes time. You're talking about, an hour per person minimum usually to get a really good story from an individual. I hope that helps. I don't know if that, I'm not sure of which context you're speaking of, but I hope that helps a little bit.
Yeah, and also Justin has chatted, I think, a link to our storytelling guidance, and so for those of you that are new, there's some really good tools and resources in our Action Center for that. We are about out of time here, ladies, and I wanted to let you know that Veronica says thanks, you're doing wonderful work. So that's a good note to end
Aw,
on
thank you.
here. Yeah, this is really great. Thank you so much for um, staying after with us for some Q&A, and just so appreciate both of you for joining us and all the work you put into this webinar, but all the work you're doing on behalf of your community. It's truly extraordinary. So thank you. And I will end the webinar.